empowerment and why we need to begin using this word more and more in healthcare. So what does empowerment really mean? So when you look at the word, it can mean to be able to give someone power. But I really want to take a little different spin off of that, because I know that we're never giving anybody power. We're only having individuals engage in the power that they already have. Okay, so think about this for a little bit. So our healthcare system has been designed that you go to a physician often wanting to be fixed, and then you're waiting for the answers. And then once you get the answers, then you take that next step as part of your healing. But what if it was a lot different than this? What if it started with knowledge? So in healthcare, what if you were educated about your body? What if you were educated about the ways that you can use your body to begin to self-heal? You know, healing is possible. If you're listening now, do you know that healing is possible? You don't need a pill. You don't need a tablet. For over 200 years and more, people were healing without any types of medications. So healing is possible. But we've been conditioned now to truly believe that healing is something that we have to go to get and that we can't activate within us. And so I think within our system as well, like healthcare right now is wonderful, right? We can do MRIs, we can do blood tests, we can investigate so many things in the body. But are all those things necessary? Are all those things needed? I would say no. And I think sometimes now, because we have so many investigations that we can do, people begin to think, I need to look somewhere else to engage in my healing. And so I want you to think again as empowerment, as first is gaining knowledge about your body. And that knowledge can be as simple as knowing how you feel in the present moment. It can be as simple as, yes, knowing your blood pressure, knowing your heart rate. It could be something like knowing your stress response. You can measure that through something called HRV. But it also could be knowing how you respond to situations. It could be knowing your emotional kind of triggers. That can be a way that you can know and understand your body. So what happens when you begin to know and understand? So number one, you get curious. And curiosity is wonderful. In my next chapter on Tuesday night, we spoke about mindful awareness, and curiosity was a big piece of that. So what does it mean to be curious? It might mean saying, okay, well, what's going on? I have this little spot on my hand. How long has it been there? What does it look like? Is it itchy? Is it sore? Did something happen? Oh, yes, I was doing the gardening, and I think I came across a rose bush. And so I rubbed up against it, and now I've got a little scratch, and it's a little bit irritated. That's kind of having a little bit of curiosity about your health. But curiosity can go so much deeper. Curiosity we can apply to all aspects of our lives. But with our bodies, we can, sometimes when we have an ache or a pain, we'll sometimes go, for many people, the default is to think, oh my goodness, I have an ache or a pain. This must be cancer, right? But what if you said, I have an ache or a pain. Okay, my left side is aching. What have I been doing lately? Okay, I'm going to talk gardening here because this is what's happening. I've been gardening. I've been using my left foot on the shovel. So now my left hip is aching. So I just need to rest it a few days, move to the other side, and then my left leg can get better. So that's curiosity. So knowledge, curiosity, being curious about your body. And then what happens is we tend to shift, like our mind shifts out of this, I can't do anything, I'm helpless, I'm a victim. And then the mind begins to shift in, I can make a decision. I have a choice. There's something that I can do about this. So this is what I do in healthcare as a physician. I'm here to guide. I'm here to ask questions, and I'm here to get curious, to help you to get curious about your own health. Because once you get curious and ask questions, then you begin to have answers. And then once you begin to have the answers, you can start to shift and think, oh, well, maybe it could be this. Is there something that I can be doing? And it helps you to gain awareness as to what's going on within you. And then it begins to activate within you this power that you had all along. And so this power means that you're not waiting for somebody to solve your problems for you. That you're being an active participant and you're owning what's going on in your life. And you're saying that this is what's going on with me. And there are some steps that I can take. There's some choices that I can make that can help me to shift. So an example of this with a patient interaction. So a patient comes in, they have diabetes, and then I see that they also have fatty liver disease. And so I tell them, you have fatty liver disease, which is often associated with diabetes, but also it can be influenced by alcohol. So the conversation first starts like, oh, doctor, I didn't know I had fatty liver disease. Can you tell me a little bit more about it? And I explain what it is, a buildup of fat around the liver. And I said it's influenced by sugar that you eat and starches. So getting your diabetes under good control is really important. Then I say that alcohol also has a big influence on fatty liver disease. So we start talking about how much alcohol the person drinks. And then I say that this can be improved. And in the early phases, fatty liver disease can be completely reversed. And then the person goes, okay, doc, so I have a choice now. I can get my blood sugar under control and I'm going to stop drinking because I don't want to end up with cirrhosis of the liver, which is a consequence of fatty liver. So now that person came into the office just looking for a blood sugar number and thinking that they were just going to talk about pills and what I would suggest next. And it shifted to, okay, I have fatty liver. I can understand now the consequences of this long term. I know that the diabetes is something that I can switch through my nutrition, through my lifestyle. And then alcohol is a big influence on this. And now I have the choice. So then the patient leaves the office and they're thinking, okay, so I've got some decisions to make here. Do I want to change my food consumption, my exercise, and my stress and my alcohol, or do I not want to change? So this is what empowerment means to me as a physician working with patients. It means that we shift from trying to fix your problems or making you feel like there is no hope, but switching to I'm capable, I have choices, I don't have to feel helpless, and that I know that in time, it's the choices that I make that will begin to influence my health. So if you're out there listening, what do you think of this? How can we further begin to shift this conversation in healthcare? How can we shift it even in our day-to-day lives, just with our families and our relationships? We all know that we can't change anything for anyone. We can ask questions, we can give choices, we can give responses, but ultimately the power to change is up to that individual. So I want you to think about this week when you're having a conversation or when you're thinking about your health, is how do I switch to making the right choices to once again being in charge and being the captain of my ship, being responsible for your own body. And if you want to learn more about how you can get curious, how you can ask the right questions and get professional guidance with me and also with my dietitian, Nursa Douglas, please check out the links to learn more about the next chapter. The next chapter, we run 2 sessions a week, Monday nights with a nutritionist for 1 hour and Tuesday nights with me. I'd love to see you there. Have a wonderful day, everyone. Take care and bye for now.